the Hippocratic Oath. Doctors traditionally swear an oath known as the Hippocratic Oath, which dates back to ancient Greece and is attributed to the physician Hippocrates. Key elements of the modern Hippocratic Oath. 1. Respect for scientific gains. Physicians pledge to respect the hard-won scientific gains of those physicians in whose steps they walk. 2. Beneficence and non-maleficence. They commit to benefiting the sick and doing no harm. 3. Confidentiality. Doctors vow to respect the privacy of their patients. 4. Respect for patients. They pledge to respect the autonomy and dignity of patients. 5. Medical integrity. Doctors commit to practicing medicine with conscience and dignity. Why some doctors stray from their oath. Several factors can contribute to doctors straying from their professional and ethical commitments. 1. Burnout and stress. Long hours and workload. Excessive workload, long hours, and high-stress environments can lead to burnout, impacting judgment and performance. Emotional exhaustion. Continuous exposure to suffering and high-pressure situations can lead to emotional exhaustion. Financial incentives can play a significant role in the decisions doctors make. Sometimes, the profit motive from pharmaceutical companies, insurance companies, or even personal greed can tempt doctors to prioritize profit over patient care. Sadly, this can lead to corruption and fraud, with some doctors engaging in fraudulent practices to increase revenue, such as ordering unnecessary tests or procedures. Systemic issues within the healthcare system can also influence doctors' decisions. Inefficiencies, lack of resources, and other systemic flaws can push doctors to make compromises they otherwise wouldn't. Additionally, pressure from insurance companies to reduce costs can lead to suboptimal patient care, as doctors may be forced to make decisions based on financial constraints, rather than what's best for the patient. Lack of professional development. Stagnation. Without ongoing professional development and education, doctors may not stay current with best practices. Skill degradation. Over time, lack of skill enhancement can lead to lower standards of care. Personal issues. Mental health. Personal mental health issues, including depression and anxiety, can impact professional behavior. Substance abuse. Addiction to drugs or alcohol can impair judgment and lead to unethical behavior. Ethical dilemmas, conflicting interests. Situations where personal beliefs or external pressures conflict with professional obligations. Complex cases, difficult medical cases where ethical decisions are not clear-cut. While the Hippocratic Oath serves as a foundational ethical guideline for doctors, various internal and external pressures can lead some to deviate from these principles. Addressing systemic issues, promoting mental health, providing ongoing education, and fostering a supportive work environment are crucial steps in helping doctors maintain their professional and ethical commitments.